Have you ever walked into a room and forgotten what you were doing in there?
All the time.
Oh my God, multiple times a day. This might be bad for me.
Yep.
Okay, well, we're not alone. Struggling to stay focused or having a mental cloudiness is often called brain fog. I've got that. I have this.
I have this
I have
too.
this.
9 News medical expert Dr. Payal Kohli is here to help us cut through the haze. Okay, first and foremost.
What you did there.
Yes, you did. I didn't write it. I can't take credit. But what is brain fog?
So ladies, we've all had brain fog. And interestingly enough, it's a constellation of symptoms. So it's not a medical diagnosis. You can't walk into a doctor's office and say, can I get a blood test for brain fog? Can I get a brain scan for brain fog? It's really you reporting this constellation of symptoms. Now, the key about brain fog is it should wax and wane, unlike dementia, which gets worse every day or progressive over time. But really, you're having trouble concentrating. You're having trouble remembering things. You don't feel like you're as clear or as sharp as you used to be, and you're having sometimes trouble with attention and other types of tasks. So, just like our body some days is more tired than others, it's kind of like our brain some days doesn't communicate as well as it should with different parts of the brain as other days. But it's important to make sure you distinguish it, like I said, from conditions like dementia, which are usually progressive.
Well, let me ask you, is this, because I really do have this and it does concern me, does this mean that I may have dementia later on in life?
Good question.
So no, we don't think that if it's truly brain fog, it's linked to dementia later in life. Now, what's interesting about that is women, after they undergo the menopausal transition, will often report menopause brain, which is essentially brain fog due to a lack of hormones. And if you give them back hormones late in life, you can actually increase their risk for dementia. So it's really important to be very careful how we use hormones in our postmenopausal women. But we do sometimes have something called pseudo-dementia, which is sort of what brain fog is. Like, let's say you have severe anxiety or severe depression. You're not remembering things. You're not concentrating. You're not focusing. That's called pseudo-dementia. So that's really what brain fog is. It's not real dementia, but it's sort of the brain not working as optimally as it should, and it needs a reset hit on it, so to speak.
How do we reset it? I mean, other than like hormones or whatever you just stated, is there anything we can do day to day, whether it's vitamins, supplements, being more mindful, writing reminders on my arm?
All of the above. So the good news is the most common causes of brain fog usually reversible. So it's mostly stuff that we're doing. We're not sleeping enough. So sleep disorders or lack of sleep has been linked to it. We're not drinking enough water. Dehydration is a big driver of brain fog. So staying hydrated is huge. We're not eating enough protein. We're eating too much sugar and carbs. That can cause brain fog as well. And we're not exercising or moving enough. So those are easier things for us to do. But you said something about vitamins, Sam, and if it's not clearing, you actually do need to talk to your doctor, because it could be that you could have a vitamin deficiency, you could have a thyroid problem, you could have inflammation after having mononucleosis, HIV, COVID. All of these conditions can leave you with long-term brain fog. So if you do those few things, eating well, sleeping, exercising, making sure that you're being mindful, taking breaks from the screen. I don't know about writing on your arm, but not looking at a screen all day long does help kind of reset your brain. And it's still persisting, then it's time to see a doctor, because you do need some medical workup.
I find it's more persistent with me in the morning. Do you find that, like, when I'm getting the kids ready, I'll run into the room like, oh God, what did I need? And I go back and I run in there again. And like, is that scientific or is that just me?
No, it could be, Alex. So it could be related to your sleep. So sometimes when our sleep circadian rhythm's disrupted, or we're not getting good quality sleep, the architecture is distorted. It could be that. If you take any medications like antihistamines, I know that the air has been so bad lately, that could certainly be linked to early morning brain fog. But sometimes it's a behavioral problem, because you're pulled in so many directions in the morning that your brain is, remember we talked about multitasking versus monotasking. Your brain is trying to multitask and it's not designed for that. You're spending energy to do that. But what's interesting is we're learning brain fog may be related to little blood clots in the brain. It may be related to inflammation in the brain. It may be related to, all kinds of chronic changes in the brain. So we're still working to figure out if there's a way we can formally assess it. Because if I give you, Alex, first thing in the morning, a memory test, you should pass if it's just brain fog. If you start to have trouble, that's when I worry that there's something else going on. But brain fog is not part of normal aging, so we shouldn't just blow it off if we are having it.
Okay, all right, Dr. Kohli, great information. Thank you.
All right, ladies.